Each and every day, nearly 1,500 people die from cancer. Currently, our national debt is more than $15 trillion and increases by $3.5 billion each day. The U.S. has more drug law violation prisoners per capita than any country in Europe has total prisoners. These issues are serious. What can we do to solve these problems plaguing our country? What if one simple little thing could cure cancer, tackle our national debt, and free up thousands of nonviolent prisoners from our already overcrowded jail system? What if all of these major problems facing our country and many others could be solved by changing one little thing? What if that one thing was legalizing marijuana? THC, CBD. What if knowing the difference between these letters could save your life?
The marijuana I don't use. I've never used any form of illicit substance. Most people watching this wouldn't either. However, if they would, they're probably using it already because it's fully available anyway.
I think marijuana use should be legalized across the board. We have seen that prohibition has failed.
Marijuana should be available legally for adults for both medical purposes, but also for as an alternative to alcohol. It's safer than alcohol, and adults should have legal access to it.
Drug prohibition as a policy is the biggest failed policy in the history of the United States of America, second only to slavery.
Currently, marijuana is classified federally along with heroin and LSD as a Schedule I drug, meaning it has no accepted medical uses. This is where the debate over marijuana becomes, well, debatable to say the least. Some people would argue that cannabis certainly has medicinal use.
There are almost 500 molecules in the cannabis plant. Approximately 100 to 110 of them fall into the cannabinoid category. THC and CBD are two of the 100 cannabinoids.
CBD stands for cannabidiol. Unlike THC, however, CBD is a non-psychoactive component found in the plant. Many doctors and patients are now saying that along with THC, CBD, although less known, is an even more beneficial component of the cannabis plant.
Internally, we have, just like there's THC and CBD in the plant, those are phytocannabinoids. We have cannabinoids in our brain that are called endo, for inside in the brain.
Scientists located two cannabinoid receptors in the body, one called the CB1 receptor, which can be found in the brain, and a second one called CB2, which is mainly in the cells of the immune system. These receptors act like a key in a lock, and once activated, they can act like a target for cannabinoids, which once combined with the receptors, can play an important role from everything from pain relief, digestion, vision, and many other functions of the body. There is a wealth of laboratory evidence that cannabis kills cancer cells in a variety of ways. Among these are that cannabinoids prevent the cancer cells from reproducing. Additionally, it also prevents the formation of new blood vessels needed by cancer tumors to grow. As well as, it also prevents cancer from spreading to other organs. That's particularly important in cancer treatment because experts are able to speed up the death of the cancer cell without touching the healthy cells around it. This is not the case with current cancer treatments, such as radiation and chemotherapy.
And it appears that we have a 2-AG deficiency, just like a lot of people have serotonin, norepinephrine, dopamine, thyroid, all sorts of deficiencies. And you give somebody a little bit of CBD, I mean, very small dose, and all of a sudden the spinning stops. And you can't spin, you can't even get it started. It's amazing.
The spinning that the doctor is referring to is the overthinking, worrying, and other symptoms associated with anxiety, ADD, and other conditions that CBD may treat. That being said, however, this is just the tip of the iceberg when it comes to what CBD is treating and what it will be used for in the future.
So generally, marijuana can be used medically to treat a variety of symptoms. It's used by, MS patients to control muscle spasticity.
For anxiety, I mean, it's virtually 100% effective at 2 to 3 milligrams, once a day.
We're hearing more and more about marijuana's treatment in cancer, in some forms of brain cancer, glioblastoma.
There's a lot of work going on around the world. There's a huge study going on, showed that a 21-day treatment of CBD, and CBD alone, kills the cancers. It turns a gene that can be on when the tumor is very aggressive off, and then the tumor goes through cell suicide, which is called apoptosis, and cuts off the blood supply to itself and dies. To me, since it's so safe, if I were able to get it and I had cancer, I'd probably take it. It's hard to believe that ultimately, 100 years from now, chemotherapy and radiation are going to be the end-all treatment for anything.
I have come in contact with hundreds and hundreds of people that marijuana transformed their life.
We're also looking at it, using it for veterans of the last 2 wars with documented PTSD, and I've treated a handful of them already, and they respond dramatically well. There's actually going to be some news coming out of a country, I can't say where, because I was promised, but that they're going to be sending CBD-rich medicine to all of their population because they have a lot of PTSD there, and the prescription use is increasing. So I think we're going to find over the next, handful of years, this is going to become routine.
Aside from the U.S. dabbling with the new CBD cannabis, this undisclosed country mentioned is Israel, whose government is already said to be growing the beneficial strand at Tikkun Olam, Israel's largest and most advanced medical marijuana facility.
Because it's been really hidden, not just hidden because it was historically lost genetically in the plant, or nearly lost, but also because our own federal government patented it in 2003. Obviously, if you patent something and you sell licenses to grow it, you must feel it has some use. And it's a big, 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 big dollar deal. So they want to be in this business, and they're in the business.
The new CBD treatments can be ingested through a spray bottle form.
I'm not a huge promoter of smoking because in medicine, you just waste 90% of it. Goes up, as Professors Cheech and Chong said, in smoke. 90% of the cannabinoids go up in smoke. We're trying a new technique where they'll get 2 spray bottles, one that's almost all CBD and the other that's almost all THC, and they can mix them. Here, you can get 95% of them into the bottle, which makes this a fraction of the cost to medicate.
And as far as the risks are concerned, medical experts are saying that the side effects are minimal.
The only side effect, well, there's 2 potential. One, which most people are thrilled about. Some people do get a little happier and cheerful. So that psychoactivity, it is a side effect, and it needs to be listed that your mood might improve, okay? It cuts your appetite, and particularly appetite for sweets. So there's more people like going on these CBD diets, which I kind of hate to talk about because I don't want it to go to that level, but it works. Just like THC gives you the munchies, CBD gives you the anti-munchies. We have strains now that we're growing that are just being harvested this week that have like a 25-to-1 ratio of CBD to THC. Our current plants have 2-to-1. This was like a genetic miracle that happened. So we'll be able to make tinctures that have as little THC as hemp does. So they'll be kind of the same as hemp tinctures and potentially legal.
To debunk the age-old question, does smoking weed kill brain cells? Well, as far as the CBD is concerned, the results are quite the opposite.
It saves brain cells, and if your brain cells are injured, it helps heal them quicker, and heart cells as well. But dosable cannabis medicine is the future.
Feeling burned out and desperately needing a vacation? Yeah, me too. That's why this Saturday, we're packing our bags and taking a first-class trip to all the best vacation destinations in the world. From Barbados to Rio, Bora Bora to Greece, and everywhere in between. It's a good old-fashioned boondoggle, all day Saturday on Wealth TV. Oh, and please, leave your Speedo at home. People of Cambodia live with memories of a violent past, but the timeless ruins of an ancient empire tell the story of a once dominant civilization. Discover the ancient mega temple tomorrow on Wealth TV.
You're watching Wealth TV. It's your life. Spend it well.
Regardless of whether marijuana is legal or not, the fact is, many people are using the substance every day under our current drug policy, which says it's against the law. Many estimates claim that 16.7 million people reportedly used the illegal substance within the last month, and not all of whom have medical conditions. Some people just like the mind-altering buzz and use it recreationally.
Tens of millions of people in this country smoking weed. I mean, are we kidding ourselves?
Certainly I know of a few, anecdotally of a few people who are, stand-up lawyers, doctors, professors, whatever, that you wouldn't think of as your classic stoners who happen to be marijuana users.
If so many people are using it already, why is the leafy green substance illegal? Well, certainly like most things that are labeled bad, there is a monumental moral debate going on across the country.
We have perpetuated this failed system for so long, basically because of one reason: children.
My kids are going to do it is obviously a reasonable concern. There's lots of things which may be reasonable for adults but are not a good idea for kids. The first order fact is kids are doing it already, even with prohibition.
We care very much about the children, which is why we would like to do the same thing that we did with tobacco and alcohol, which was put an age limit on the substance, and studies show that young people's use of both tobacco and alcohol declines significantly.
If you legalize and regulate something, such as marijuana, that is actually going to prevent access.
You do not see children on their high school campuses selling Jim Beam bourbon to each other, but they're selling illegal drugs all the time, caused by drug prohibition. Ask the first 10 teenagers you find what is easier for them to get if they want to. That's the key. Marijuana or alcohol. And they'll all tell you, to the degree they've thought about it, it's easier to get marijuana. Why? Because the illegal marijuana dealers do not ask for ID.
Then the sellers would be people who would be above ground, who would have an incentive to not violate the rules against selling to minors, whereas right now the people who are selling to minors are already felons merely by selling the good at all, and so they don't really care that much whether they're selling to a 16-year-old or selling to a 25-year-old. Now, maybe more kids will do it if it's legalized, although our experience with alcohol, it doesn't really suggest that. One person's focus on the use from a moral perspective shouldn't crowd out our focus on all these other effects of causing lots of violence in Latin America, which presumably also has a moral dimension, if you want to think of it in those terms.
When it comes to marijuana, people are essentially legislating morality. They feel that marijuana use is immoral, and therefore it's illegal, and therefore if you use it, you're a criminal. These are decisions that people are making for their own bodies. And these are decisions that should be left to the individual to make.
The whole thing of having 16, 17, and 18-year-old kids getting stoned is not something we're looking for, but having a war against it has not worked.
It is certainly true that many people who consume harder drugs have also consumed marijuana in the past, and many of them had consumed marijuana before they consumed the harder drugs, although there are obviously plenty of exceptions to that pattern as well. But the main fact is that zillions of people consume marijuana and don't go on to harder drugs. Millions of people consume alcohol and don't go on to marijuana. If you just look at the temporal sequencing, you would say that French fries are a gateway to alcohol or to heroin or whatever, because everyone who's consumed heroin has consumed McDonald's French fries back, when they were kids or something like that. So it's just a completely unpersuasive hypothesis for which there is not good evidence.
Aside from the moral issues at hand, 1% of the population does in fact struggle with addiction problems. And when posing the question, should marijuana become legal,